So now I am doing surgical crying. Okay. So three finger technique in the midline, approximately 1 inch. Okay. You can use Cali also, or you can use finger to dilate. So I am in bougie tube. So you can do surgical cricothyroidotomy. Okay. Now next is needle decompression. Pause. So like this is first you can play pneumothorax and then you can place this bladder and you can play hemothorax scenario also. I will demonstrate. So we are now going to do needle decompression and ICD insertion. So you can see the left side is rising. There is a chest rise on the left side, but right side there is no rise. So distended vein. So we will go for needle decompression. Upper border of the lower rib. You got give you a feeling, and there's a air. Okay. So now we can put the ICD also. But before that, now after the needle decompression, the chest is rising on the right side as well. Yes, you can see. So this is what really happens in clinical scenario also. Patient chest start rising and patient has significant improvement. Okay, so now we will show hemothorax. So now I'm simulating scenario for hemothorax. Okay, so just anterior to mid XJ line, upper border of the lower rib, 1 inch, at least 1 inch, skin and subcutaneous tissue, then the Cali, volar puncture. Okay, so there is the blood, and then we will insert the tube. Oh, before that we will do finger sweep. 360-degree finger sweep, and now we will insert the tube. Let's see. Well, this is messy. Usually I don't recommend hemothorax, but people demand, so we have here. So now, so the whole blood has been drained. Okay, so let's see. Actually, this is slightly, let's see, messy, but okay. So you can see the lung also. Okay, right. Chalo. Now, now coming to, you can do, no, we will do, uh, yes, we can put central line also. So since I am standing here, so I'll go from this side. Otherwise, we can do from the left side. Okay. Give me the probe, Harry. आप अपना काम करो. So you can see the vein. Now I'm puncturing it. That's our needle. Screen. Now we are puncture. You need to do some manipulation. So we have hit the vein. and there our needle. You can see. Give me gel. We'll just show you the needle clearly. Screen. That's our needle. Okay, so we'll pass the guide wire. Hold the probe. Should go freely. Now let's see where the guide wire is. That's our guide wire. Okay, hold. Catheter over it. That's the catheter. So you will have to use our catheter to simulate this central insertion. Okay, so you can put subclavian also. Okay, so you can see now the E fast is positive. Please, now you can see this is the kidney, this is the free fluid, liver. I'll just change the again unfreeze. You can see. So there is a free fluid. Now you can see. Freeze. You can make it E fast positive. Okay. Now you can have bladder also here. Okay. Then left quadrant view, again kidney and free fluid. This is free fluid. So directly patient can go to OR for resuscitation if you want to show him hypotensive. Okay. Drain the needle. Drain the needle. That's our needle. And here come our urine. So you can do this also. Okay. This patient is crashing. So knee joint, this is the tibial tuberosity, anteromedial surface. We have to go 1 to 2 centimeter. Till we get give a feeling. Needle, fixer, connector. So in obese patient, you have to use yellow needle. That is approximately 5 centimeter. So the yellow needle was probably not appropriate length, because we will try with the blue needle again just to show. So if the patient is obese, then you have to use yes, it is not going into the marrow because of the length. Now we will try. Give me yellow. Because you can attempt number of times. Anteromedial surface. So that is like you have to be careful. If patient is obese, use yellow needle. Otherwise, you can use blue needle in adult. and up to 40 kg you have to use red needle. Okay, so you can do IO access, or now you can do splinting of the fracture, and DPA is palpable. You can nicely feel DPA that is there. Okay, now next skill is how to apply a cat tourniquet. So with this, to play first catastrophic bleed, apply the tourniquet. So now it has stopped, or you can convert, if doesn't stop, into pressure bandage. Okay, after applied, or you can apply the second tourniquet. So this was catastrophic, like if you want to play X initially. Okay, these are the greater trochanter. So we have given greater trochanter because the pelvic binder need to be applied at the greater trochanter. So these are the greater trochanter we have given. Okay, so you have to come from below. Point is greater trochanter. Okay, of course you can use a bed sheet also. Okay, okay, the block. Okay, that will complete our resuscitation. So I am applying and I am showing the psoas tendon. So we are going for the pang block. Okay, so that's the inferior eminence, and that is the on the screen. So that's our needle. Yes. So that's the tendon. Okay. So we have just gone below the tendon. So you can, now I'm feeling the bone also. Okay. So you can apply pang block. Now I'll show. Now the saphenous nerve block. Okay. So again, show the artery, vein, and nerve. So I'll just focus again. That's our needle piercing the sartorius. Now, okay, here you have to deposit. So that's what you have to learn. You have to visualize both the nerve as well as the needle. So that's what you can practice here. Okay. Now nerve is gone. You can see only needle. Okay. Slightly lower down. It's a field block sometime. So you can practice lower down also. Okay. Similarly, apply the pure nerve block also. Okay. So just for the sake of demonstration from this side, so you can see artery, nerve, artery, nerve, vein niche. Yeah, that's the vein. Again artery and nerve. This is the nerve. Okay. So we have to come. So similarly you can practice. This is the femoral nerve. Okay. Now show the. This is head injury, and the pupil is dilated. Okay. So this is in D. And the moment. So once we have resuscitated, eye movement without. So it can move eyes. So you have resuscitated. Now he is moving his eyes. Oh. So these are the various features we have incorporated in this Moulaged patient, and hopefully if somebody detect all the problem and resuscitate this patient, I think he can be safely, we can call that he is a well trained person. Thank you very much.